All right, everyone, we are going to go ahead and get started here. The Center for Health, Work and Environment and the Center for Bioethics and Humanities are pleased to welcome you to our third webinar in our Ethics and Future of Work series, exploring ethics and protein processing workers. We have a really exciting conversation prepared for you today, and obviously a wonderful group of panelists lined up here, as you can see. So I'm going to go ahead and just go over a few brief technical logistics, and then we will go ahead and get started. So today, this is a webinar format Zoom meeting, so all participants will be kept on mute throughout the duration of this presentation. However, if you're having any technical difficulties, please feel free to use the chat function on your Zoom toolbar, and our team will help to address any of those technical issues that you're facing. If you have a question that you'd like to pose to our panelists, please use the Q&A box on the control panel of your screen. This will be able to show the question to the panelists, and our other participants and attendees can also upvote these questions and like the question if you would like to be able to make it a more popular question that could potentially be asked to our panelists. This webinar is also being recorded, so it will be available after the meeting if you would like to be able to share it with any of your colleagues or watch it again. And there will also be a survey at the end of this webinar, so please take a minute to complete that survey to give us some feedback on this webinar series. This is also where you will be able to claim your continuing education credits as well. So without further ado, I would like to introduce our moderator, Dr. Mike Van Dijk.
Good afternoon, everyone. Very excited to be here. As Madison said, my name is Mike Van Dijk. I'm an industrial hygienist and associate professor at the Colorado School of Public Health and the Center for Health, Work, and Environment. I'd like to welcome you to this webinar today that's going to focus on the intersection between occupational health and safety and ethics in the beef, pork, poultry, and seafood processing industries. When we talk about protein processing, we're not talking about protein shakes. We're talking about meat processing mostly. So we're really going to have a strong focus this afternoon on the issues that we identified and the lessons learned during the COVID pandemic. So I'm going to be the moderator today. And just for background, I did spend several months at the beginning of the pandemic working with the meat industry to help identify ways to mitigate the spread of COVID in these plants. And our panelists have even more experience than that. But before we start, just to make sure we're all on the same page, I want to go back in time a little bit and give a little bit of background to jog your memory on meatpacking plants. So remember, as the pandemic started, meat processing workers were deemed quote unquote essential workers and remained on the job. And really, meat processing was the first major non-healthcare environment where we started to see significant COVID infections in March of 2020. During this time period, a lot of the folks on this call got involved with the meat industry, as well as myself. And what you saw was you saw OSHA and NIOSH, they both released occupational health and safety guidelines for this industry in late April of 2020. And this was closely followed by a Trump administration executive order that declared meat processing a critical infrastructure, which compelled plants to remain open during the pandemic. Now, there's a whole lot more to this story and lots of articles out there to read. But really what I want to focus on is the incredibly sad outcome that was recently cited by the Congressional Select Committee on the Coronavirus Crisis. And they cited that among the top 5 meat processing companies, there were over 59,000 COVID cases and 269 deaths among workers. So our goal today is really to discuss the ethics of occupational health and safety in this industry and identify ways to prevent this type of tragedy in the future. So for that, we have assembled a fantastic panel of experts to discuss the topic. Right now, I'm going to give them each an opportunity to introduce themselves and describe how they became involved in this work. And I'm going to start with Dr. Athena Ramos from the University of Nebraska Medical Center.
Well, good afternoon, everyone. My name is Athena Ramos. I'm an associate professor in the Department of Health Promotion at the University of Nebraska Medical Center in the College of Public Health. I have been working with meatpacking now, even before COVID hit, so for about the last 5 years, but I actually came to this work through my engagement with the farm worker community. And over the past decade, I have been doing research, education, and outreach with farm workers and farm worker families. And so for me, this was a natural extension of the work that we were already doing to really engage the full spectrum of the agri-food system. I have a passion for social justice and for underserved communities and for being with workers and trying to advocate for the best possible outcomes for workers, including those related to health and safety. So thank you for having me.
Thank you, Athena. The next we have Abby Lowe from the University of Nebraska Medical Center.
Yeah, and thanks for having us today. Excited to be here and to talk about this important subject. My name's Abby Lowe. I'm an assistant professor in the College of Allied Health Professions, working closely in the Global Center for Health Security. My central area is ethics, but within the realm of health security. So if you can remember back to early 2020, the Global Center for Health Security supported repatriation of folks from Wuhan, China, over to the United States. And quickly on the heels of, taking care of quarantine and isolated individuals, we moved into a space where we were trying to provide guidance on infection prevention and control for hotspots, which were meat processing facilities across the state of Nebraska. So at that point, I became part of the site visit team, thinking about ethical and policy concerns as we were visiting these different facilities and thinking about some of the issues related to health and safety of workers, as well as a power gradient for workers in those industries. So.
Thank you, Abby. Next we have Julia Coburn from the Center for Migrant Worker Rights, or that would be the English translation of where you work, since I didn't want to destroy that. So you can please give us the Spanish word.
Thanks, Mike, and thanks also for the opportunity to be here today and learn from the other wonderful panelists in our audience. And so Centro de los Derechos del Migrante, the Center for Migrants' Rights, is where I'm based. I direct health initiatives for the organization, and I've been here for about 7 years, actually a little bit longer on and off, since 2008. And as an organization, CDM was founded actually in Mexico, where I'm based in Mexico City, to help address the problems that migrant workers face when working in the United States and upon return to Mexico. We now, that was actually close to 17 years ago that we were founded. We are now working binationally with offices in the US and Mexico. And in 2020, turned our sights to the disparate impact that COVID was having on immigrant and migrant worker populations, especially in the protein processing industries. We have a long history working with seafood processors, principally seafood processors contracted through seasonal work visas under the H-2 program, and have also a long history of collaborating with other organizations and institutions, and kind of built this project together with the CDC to try and tackle the outbreaks that were occurring, and then later to also help facilitate access to vaccines and other health information. So yeah.
Thank you, Julia, and thank you all for joining us. So we're going to jump right in. And because we know that everyone on the call isn't necessarily fully familiar with the working conditions in protein processing plants, we're really going to start with a background, really talking about the workforce and the working conditions in these industries. So I'm going to start with Julia, and after Julia answers, if anybody else wants to weigh in, please feel free. But I'm going to ask, what can you tell us about the workforce in the protein processing industry?
Sure, and this is going to be a huge generalization, of course. And I think also want to step back and sort of say that the protein processing industry, we're talking about, it's a way to sort of capture a lot of kind of diverse sectors of workers who share certain kinds of experiences and through their employment. So we're talking about seafood workers, we're talking about poultry processors, meat packers, potentially kind of at different stages of that, in pork, et cetera. And kind of generally speaking, we're talking about really one of the most diverse industries in the entire country. There have been examples of, from the pandemic, especially where, outbreaks have been reported in industry and workplaces where there are over 40 languages spoken. It's an industry that is increasingly relied on immigrant and migrant workers. I think an estimated, and it's hard to get the numbers really on this too, super accurately, I think, because of sort of the different stages of informality and subcontracting that also tend to occur in the industry, but an estimated 40 to 50% of processing workers are classified or identified as immigrant or migrant born outside of the US. Again, depending on kind of where you're looking, this is very general. About a quarter of meatpacking workers have been in some studies classified as coming from a limited English speaking household. So folks who don't prefer or tend to speak English. But generally speaking, we do know that kind of nationwide Spanish continues to be the dominant language spoken in processing plants. Maybe about 2/3 speak Spanish, again, based on some studies and estimates that we have. But then when you kind of go down that tier to the next common language, we're talking about an incredible range of diversity that's almost difficult to capture, ranging from indigenous languages from Mexico and Central America, Quranic languages, Cushitic languages, often dozens, as I mentioned, within the same plant. And then in seafood, I'll just wrap up to say, we tend to see a heavy reliance on H2 seasonal workers. It's very characteristic of that industry across the country. Folks principally recruited from Mexico to work seasonally in crab processing, canning industries kind of across the country.
Is there anything you want to add, Athena or Abby? Okay. So, I mean, given the high prevalence of immigrants and migrants in this workforce, what can you tell us about the relationship between immigration and health and safety in general? And it doesn't necessarily have to be just focused on protein processing, but how do those two work together or not work together?
Yes, understanding immigration and sort of what folks go through as immigrant and migrants in the United States is really key to understanding folks' abilities to work in healthy and safety conditions, or really generally, I think, to impact the conditions in their workplace in so many ways. Because as an immigrant or migrant, sort of, you face a number of barriers, right? Sometimes those could be language or cultural barriers to having dialogue with your other coworkers, with management, so even just sort of asking questions, to reading posters about, chemical hazards at work, or about, proper mask use, things like that. To having conversations about changing work conditions, about organizing, to be able to kind of relate to folks, to really, speaking up and pushing back against power, I think is kind of the analysis that we have at CDM. The power imbalances become extremely great when we're talking about immigration status. It becomes a very powerful tool as well to leverage for power holders, employers, supervisors, when immigration status makes you vulnerable to retaliation. And that's something that we see a lot. So this, the cost of really defending your rights at work, of speaking up in any way, becomes a lot greater when you also carry this burden, sort of this artificial burden of your immigration status making you more vulnerable to retaliation or negative actions.
Thank you, Julia. So kind of moving more specifically into the meat processing industry. Abby, what can you tell us about the working conditions in the protein processing industry, and really specifically focused on early pandemic conditions?
Yeah, well, the first time I ever went into meat processing facility was early in the pandemic. And so, I think there were a couple things that stood out to me, which was there was a lot of fear at that time. You have an emerging infectious disease with not a lot known about it. There's even, if you remember that time span, we were still trying to figure out what masks work. Does everyone need a mask? Is washing your hands more important? So there was a lot of just baseline confusion on infection prevention and control. And then you have you have hotspots in meat processing facilities, which I think, that for facility leadership and staff to figure out a infection prevention and control plan for their facility when they've never kind of been in that world is an ask for sure. But I think, from our perspective, visiting those facilities, our main point of contact was more leadership, but we knew based on, and Athena hopefully will talk more about this, doing a survey that went out to workers, I think just a little bit under 600 workers across the Midwest, we were able to kind of rapidly gather data on how workers were feeling. But we knew because of absenteeism in the facilities that there was a lot of fear. And there was a lot of concern over their health and safety. They were hearing stories. They were knowing friends who were in the ICU, who were sick. So there was a lot of confusion and fear in those early stages of kind of when I was on site in the meat processing facilities. The other thing that was really difficult to ascertain was what protections were available to meat processing workers as we were experiencing, the first blush of the pandemic, and particularly what policies did they have in support? Were they still getting penalized by points for being absent from work? Did they have any sick leave to be absent to cover kind of their salaries and income? What was food insecurity like at that moment in time? So there were a lot of circulating issues for us, and part of my role on those site visiting teams was to kind of push up on those policy issues and try to get a straight answer on what was happening. But again, I think that one of the main things that early pandemic was a great sense of fear, and then a lot of pressure from the industry side to continue production. And I think, the other piece that I'd mention is production had dropped so significantly in a lot of those meat processing facilities that it was causing downstream impacts to ranchers and to other growers. So we were seeing kind of a whole ecosystem be impacted by actual disease, but also by concern. And do we have adequate protections for workers that were being asked as the executive order that came out April 28th to continue going to work. I don't know if anyone has anything to add to that, but that's definitely early pandemic, the climate that I saw.
I do want to add, I want to make sure people have a picture in their head of somewhat what it looks like. And this is, keep in mind, this is really hard physical labor. These folks are working very hard. This is exertion. And these folks they're working close together, side by side, face to face. They could be working in cold environments or hot environments. And really, these are facilities that you have lots of languages spoken, as we talked about. You generally have a high turnover rate of employees. And, you have workers who are really paid based on their production. So all these factors kind of play in later, but I want to make sure that we have a picture of all those things in these facilities. So Athena, what can you tell us about what workers said about culture in the facility, safety culture in the facilities pre-pandemic?
Sure, I'd be happy to talk about that. So in 2018, we actually conducted a study with meatpacking workers here in Nebraska. And as part of that mixed method study, we actually conducted a series of focus groups to talk to workers about how they experience the safety culture in their facilities. And what we learned from these workers was that they felt like these facilities prioritize production over people. We heard lots of comments about how a cow or a bag of meat was worth more than a worker's well-being. We also learned that workers felt very powerless. They felt like they didn't have a voice. And so there wasn't really a need to speak up because you just have to conform. You have to get in line or you're going to lose your job. And third, we heard from the workers that they felt like the work was very precarious. That, for example, when they were hired on, they went through a safety training and they were told, hey, you know, the work is dangerous, so use your PPE. But basically, we already told you it's dangerous. So if you get hurt, it's your own fault because you didn't listen or you didn't do something right. And so that was part of how they felt that precarity, but it was also in terms of sort of what Julia was mentioning before about how there was a lot of fear. They felt like their job was constantly on the line if they didn't do what was needed, or if they didn't come into work, or if they needed to call in sick, any of that. And so there was just a real temporality and a lack of job security that they also experienced as precarity in this line of work. So we felt like what we heard from these workers was very consistent with what others have heard all across the country and across the world. There was a report in 2009 that came out from Nebraska Appleseed that also documented, you know, just dismal conditions within these facilities. And there's been reports by Human Rights Watch and many, many other groups across the world who have documented this. So this industry has been a subject of lots of human and labor rights reports over decades. And in fact, OSHA had put together a special emphasis program for this industry because of the high rate of injuries, of job-related injuries and illnesses, and you know, even before COVID hit. So this is an industry that has a pretty poor track record in terms of safety. And the workers also reported that in their focus groups and their discussions with us, and they would have classified the safety culture as being fairly poor.
Thank you. Yeah, no, if anybody ever wants to talk about meatpacking, just go back and read The Jungle. And, you know, it's progressed a ways since then, but some of the issues are still there for sure. So now really focusing on some of the COVID specific workplace issues. So Abby, so thinking back to the beginning, you were asked to come into these plants and really provide guidance on how they could really mitigate their infection risk. What kind of evidence base did you have to really develop this sort of guidance?
Yeah, I think one of the things is that the teams that go on the site visits it's a really great interdisciplinary team. So we have occupational health experts, we have industrial hygienists, we have infectious disease scientists. So it's really a big kind of effort. Athena as well, like, you know, thinking about, you know, all the hands that touch the playbooks that we put out on infection prevention and control for these facilities. But I think, you know, the short answer is that there wasn't great evidence base outside of healthcare for infection prevention and control in something like a meat processing facility. So, you know, the literature is scant on evidence base on thinking about transmission dynamics of disease, all the things that we would look for to kind of build a protocol on had to be adapted based on a healthcare environment, which is very different, right, than a meat processing environment. The other thing that I think is really different as well, which Athena just kind of mentioned, is that there is a culture of safety in infection prevention and control, especially when you're thinking about infectious diseases, that is central to all the protocols that follow. So that people really take responsibility for the safety of one another. If you have a breach in your PPE and you don't see it, one of your coworkers does, there's a way that you handle that. And it's kind of all rooted in this idea of that we're all responsible for the safety of one another. So that's what these protocols kind of are shored up by as well. And so I think that part of me being there as well was recognizing the limited agency that workers had to ensure the safety of themselves or the safety of coworkers if they weren't getting the protections they needed to be healthy and safe in kind of the face of an emerging infectious disease like COVID.
No, that's great. That's a really good way to think about it in terms of the employee's agency. I mean, I think from my perspective, it was a full paradigm shift. I mean, we had never gone into a facility thinking about the employee as the source of the exposure. So every kind of occupational health and safety paradigm was out the window to start with. So we had to really start thinking a lot differently. So Athena, when you were talking to workers, what did they really say about the situation in the facilities and the availability of some of these protections early on in the pandemic?
Yeah. As Abby mentioned, I was a part of this team. And what we learned was that as the site visits were ongoing, that perhaps we weren't getting the full story when you visit the plants. And so we wanted to really understand what workers were experiencing. And based on our knowledge and our conversations and our dialogue with community partners, they said, that's not what we're hearing. And so what we did is we actually conducted a survey in May of 2020, so right at the very beginning of the pandemic. We had the survey open from May 7th to May 25th, so like a 3-week period of time. And we have had over 1,000 responses on the survey, which was really incredible. You know, I've been doing farm worker work, like I said, for the past decade. And, you know, we spend years trying to get 200 or 300 responses. And so to get over 1,000 responses in a 3-week period, I was floored. I was amazed, but it spoke to the importance of this issue and the fact that workers wanted to be heard and they wanted something to be done. So after cleaning through the responses, we had 637 usable responses. And what we found through this survey is that workers were reporting that they were having temperature screening at the point of entry of the facility, that the facilities were ensuring that people were wearing masks, and that there was basically some information posted in some languages throughout the facilities. But the things that we know really make a difference, like increasing the distance between workers on the line, like slowing down the line so that you don't have to run between stations and to try to get your, the product moved, making sure that people have access to paid time off if they're sick or if they need to quarantine, and making sure we're reducing the density of people in the facility overall. Those things were the least frequently reported things from the workers. So we gave them a series of questions. Is your workplace doing this, this, or this? Based off the guidance that we had developed in the playbook, and those were the results. One of the other core things that we offered was an opportunity to share some comments and to, share your story. I had little idea that, people would share so much, but they did. We had hundreds and hundreds and hundreds of comments, which was really, again, incredible. So we actually did a thematic analysis of all of these comments. And what we heard was that, again, these workers were describing the workplace to be one that prioritizes production over people. For example, one of the workers noted, "Aren't we essential workers? Then they should take better care of us and respect our lives more than money. They only care about the money. Each person's life for them is just another cow." Workers also talked about the fear and distress that they experienced due to COVID. I mean, imagine working on the line, somebody doesn't show up next to you and you wonder what happened because nobody tells you what happened. There was no transparency. You just assume, well, they had COVID, but what if they don't come back in their 2 weeks or 3 weeks or month or ever? I mean, imagine that distress that individual may feel. Third, workers felt like the workplaces that their employers had taken action a little bit too late, if they had taken any action at all. And they felt like the financial incentive system that had been put into place by some of these facilities was something that motivated people to continue to work even if they were sick. For example, there was facilities that were giving a $30 daily bonus if you showed up. Or another company was providing a $500 bonus at the end of the month if you showed up for all of your scheduled shifts. But the workers know better. They know that these things actually put other people in danger. And they talked to us about that. And finally, the fourth theme out of these comments was that workers really described themselves to be structurally vulnerable. They felt like they didn't have a lot of recourse to be seen or heard. They felt like they weren't valued and that their employer didn't care for them. There was many comments. And I think that just aligns with the safety culture that they had described, previously. So it seemed like business as usual, except we added in just another layer of difficulty for workers with the pandemic.
Those are fascinating responses. I mean, just for everyone here, these attendance bonuses. So this policy that you got paid to come to work. And was this something that you found was implemented during COVID, or was this, a consistent policy even pre-COVID?
These quote unquote responsibility bonuses were a new COVID feature that at least among the workers that we had talked to. So it wasn't something that they had generally had. However, now that we're a little over 2 years into the pandemic, there are some companies that have maintained some sort of bonus structure for their workers. Like, for example, now I've heard about a bonus for getting vaccinated. So one company was giving like a significant amount of money to workers if they got vaccinated. However, they're doing it over 3 time points. So it's spread over 18 months. So you get, a chunk of it, a third of it at 6 months, a third at a year, and a third at 18 months. So if you're not there, well, you don't get the bonus. So again, it's another mechanism of control to make sure that you have workforce.
And I think that's a common theme throughout the industry. I mean, it's difficult to hire, difficult to keep your workers in jobs. It's a tough job. So I definitely think you see that. So Abby, what practical challenges did you see in terms of implementing or protecting these workers during the early stages of the pandemic?
Yeah, I think, right off the bat, and this is just to kind of go off the last thing that we were talking about with infection prevention and control, I think just appropriate science for infection prevention and control guidance in meat processing facilities. So having evidence-based practice for meat processing facilities is number one. But then I think more basic than that is adequate protections. There were definitely early on facilities that didn't have adequate supply of masks, that had to have workers wearing the same mask, even though it would be covered in liquid, kind of in blood or, whatever, and they weren't able to change it out because there weren't enough. And I think then too, when we learn more about the transmission dynamics of a disease, being able to say something like, well, it would be most appropriate for them to wear N95s, but that would require fit testing, that would require training, all the things that come with N95. So that's, again, another practical challenge that you saw when healthcare workers ended up saying, okay, yeah, we do need to step it up. We are learning that this disease is airborne. And meat processing facilities didn't get the same level of policy level protections, guidance from the CDC on masking that healthcare workers did. And that was for practical reasons. And then I think also a big one too is enforcement of good safety protocols. I mean, there was just no way to enforce it. And, as our site visit teams were going to facility and going back and doing consults with these facilities to try to help with health and safety measures, there wasn't any way to say, you have to do this. There was no teeth for us. And I think, you know, Athena mentioned this before, but, you know, it's like, take the easy, leave the hard, right? So the easy ones they do, the spacing for breaks and in locker rooms and things where you knew that they needed to be mindful of how many people would go in those spaces at one time, but that would impact production. And so those didn't necessarily happen, or, you know, intermittently did. So those are some of the practical challenges. I also think I'll just add in there, just access to care, to healthcare, access to testing, access to the supports that they need to be healthy and for their families to be healthy as well.
Those are great observations. I'm just going to add that, you know, in April of 2020, you could not get a mask. I mean, so I remember talking to these folks. I mean, any mask, whether it was a surgical mask, an N95, or a fabric face covering, you just could not get them in the numbers, in the thousands and thousands that they needed in these plants. So that was definitely a challenge early on, as well as, just like Abby said, really the science wasn't there. Julia, do you want to add on to that?
Yeah, and I was going to say too, just from a structural perspective, I mean, the enforcement agencies like OSHA wasn't doing inspections. You know, no one knew how to respond. Folks were, you know, not doing outreach. Organizations were not doing outreach. We were included. You know, in order to protect staff, we're unable to then go and, you know, use like literally mobilize the manpower to support workers. The agency's processing visas, you know, consulates shut down. So that meant processing changed. It meant we literally could not reach people where we normally would have reached them. Like everything changed from kind of that infrastructural perspective as well. Courts were closed, you know, being able to actually bring proceedings forward on even kind of health and safety issues that had been outstanding previously were all frozen as well.
Yeah, can I jump in there too, Mike?
Sure.
I think it's also important to note with some of the things that were instituted in the facilities, like I mentioned, like having multilingual information on posters. You got to think back to the composition of the workplace. Do a lot of folks read? Is that the best way to share information? And usually it's not. And we rely on a lot of outreach workers and support services to be able to share information in a culturally, linguistically, and contextually relevant manner. And so even though there may have been some information, was it really getting the point across? Were workers really understanding? And maybe the answer is no.
You know, I think it really hit home for me when, you know, we were trying to implement a symptom screen. And you have a symptom screen where you have a couple people that are supposed to screen all the workers walking into the plant. And when there's 50 languages spoken, you know, how are you going to ask people about symptoms that everybody's going to understand and that the folks asking are actually going to be able to get the answers that they need? So, I mean, it's such a huge challenge. So Julia, I hope we're not stealing your thunder here on the next question. And really the question is, do you think that there are unique concerns related to COVID in protein processing due to the composition of the workforce?
Yeah, I think, you know, kind of staying on topic of, you know, the disproportionate kind of makeup of this workforce being immigrant and migrant, you know, a lot of folks, you know, the messaging, you know, that we wanted folks to hear and trust was coming from CDC, state health departments, local health departments, and some National Guard, you know, was showing up to do mass vaccinations. But for immigrants and migrants, most have spent all their lives avoiding government as a survival mechanism in the United States. And also, you know, depending on the immigration context, possibly also in their home countries, right? Like the state has not been kind of a source of trusted support and maybe something to be avoided at all costs, kind of depending on who you are. Not for everybody, but I think for a lot of folks that we see, especially undocumented communities, which do tend to be heavily employed in this industry. We've talked about language concerns, of course, and kind of barriers related to that. But also I'd say for the H2 population. We spent a lot of the pandemic at CDM trying to kind of liaise between migrant worker communities and governments who didn't have guidance or protocols to really address this community. So we're talking about folks who seasonally, dependent, some for decades on working in the US. They've lived in the US for more years than they've lived in Mexico, for example, but depend on that kind of seasonal migration. And we're just in a total information blackout. Vaccines are different in Mexico than they are in the US. And there was, and still is, a lack of kind of alignment around which vaccines folks can get and can come into the US. And in Mexico, it's not a choice, or it's only become a choice for some people very recently, in a matter of recent weeks. And we're talking about folks who are traveling from, in terms of exposure risk, they're traveling together, often from a rural community to, like a punto de reunión, like a meeting point, maybe near the border. They're sleeping in hotel rooms that are maybe between 4 and 10 people per room, sometimes covertly because of some of the sanitation protocols in those municipalities that weren't allowing them to, but there was no practical alternative. Living in community quarters up in the US, they're in very rural areas. So just all of this compounds in terms of heightened exposure risk, and then, and lack of access to even communications channels. Some folks don't have, in the US or in Mexico, a phone. They don't have a Wi-Fi. So they're really highly dependent on, often maybe their recruiters or employers relaying information to them about the context, what's safe, what's allowed, what's true. And so that also generates additional layers of coercion that came through because of the pandemic.
So I'm going off script, but I don't want to miss this opportunity. And this is, for anyone that wants to answer, but I feel like, we've spent a lot of this pandemic, at least the later part of the pandemic, really thinking about trusted messengers for information. And, what do we know about trusted messengers of information for immigrant or migrant workers? Anybody?
I'm happy to jump in.
Sure.
I kind of started us off on this, but if the government isn't maybe the trusted messenger, who is? And we've spent, we had some instincts with this project that we, launched together with CDC. A lot of it is relying on pushing through validated message through trusted messenger networks. And we did some surveying as well, both in-depth qualitative interviews and some quantitative kind of rapid assessments last year to try and hone in on communications channels. I think a lot of the pandemic efforts to reach workers that, for logistical reasons in some part, but also for reasons of, kind of power and influence for others, have been directed at employers and companies, and get it to the companies. If it gets to the companies, it'll get to the workers. And what we found in one of our surveys that we did in Delmarva, which is Delaware, Maryland, Virginia, it's a very processing intensive peninsula, combining those 3 states. With processing workers there, is we found that most processing workers ranked their employers the #1 source of COVID information, but very few, except white workers, identified employers as the #1 trusted source. In fact, in some communities, we especially surveyed Haitian Creole speakers and Spanish speakers, employers did not show up among the trusted sources at all. So there's just kind of a disconnect. So then we asked, who are the trusted networks? And that's the thing, is it is very hard to generalize. We talk about, kind of culturally specific channels that have been created. Some communities are very, very close-knit. Haitian Creole speaking community in that region, for example, there's a community radio station that a lot of folks tune into that's also connected with kind of some faith leadership. And so that was kind of a very clear place that folks would go, and it's also online. For Spanish speakers, much more diverse, talking about, immigration contexts, different countries of origin. Some folks also identify as Indigenous and speak languages other than Spanish as their first or primary language. So it starts to fracture. We talked to Congolese, refugee communities employed in processing in like Kentucky, for example, and their trusted messengers are of course very different. So we started to see also sometimes patterns of certain types of messages of misinformation circulating among social media, even among different immigrant and refugee communities, but who are connected to a community of faith. So it's very interesting and challenging, but I think we found, we've kind of placed our bets on community-based organizations that have just spent so many years in the communities and may not know absolutely everybody, but definitely are at a much better place to put messages out and work with community members to create messages and to kind of expand those maps. That's been kind of our approach, and it's worked well. I mean, it's kind of locally thinking and seeing what those communities' histories are and their preferred channels for communicating in addition to the trusted messengers themselves.
So what you're saying is health communication is really hard. Essentially, I mean, you need lots of channels, lots of different outlets, and it's tough.
It's hard if we take the approach we've always been taking.
Yeah,
I think that if we flip our thinking around it, it's not because it's not hard. It's not been hard for the community-based organizations who've been doing this work like clockwork for so long. But it is hard for, the kind of state infrastructures that have been built in sort of a, not to prioritize those folks that are classified as hard to reach, but to prioritize, kind of the lowest hanging fruits.
Well, and I hope one of the lessons learned from all of this is that we get a lot better at health communication as state agencies, as universities, as employers. So I'm going to move on just a little bit here and really focus a little bit on essential work and ethics. So I'm going to start with you, Athena, and I really want to hear about what workers have said about their experiences as quote unquote essential workers during the pandemic.
Yeah, so we have done, let me see here, about 80 interviews, qualitative interviews, in-depth interviews with workers from over the last year, let's say. And one of the questions that we asked them is, what do you want the world to know about being an essential worker in a meatpacking facility? And that's the last question that we ask them, but that's often the one that elicits the most information about their experience. And I guess we could classify responses in a couple of different ways. One, they talk about the impact that COVID has had on the workplace. They talk about the illness that they may have experienced or that they may have watched among their coworkers, and the fear that has brought to themselves. A lot of times people not only fear, getting COVID for themselves and for their own health, but they fear bringing that home to their family and bringing that home to their friends and being that vector of transmission. And they talk about a lot of uncertainty in terms of the work environment. Like, you don't know if you're going to be able to go to work. You don't know how many hours you're going to work. You don't know how many days you're going to work. Production is, kind of always shifting, and there's a lot of uncertainty about that. Workers also talked about this pressure to work. And, it kind of goes along with that idea about production over people. There's a lot of pressure being put on supervisors to make sure that they have, an adequate staffing for the production goals that the company needs. And so it's on the supervisor to make sure that you've got these folks in line. And they talk about that pressure that comes from the supervisor, like not letting them take leave or trying to figure out a way. Like early on the pandemic, the workers talked to us about how their supervisor would tell them, hey, take a Tylenol so you can pass through the temperature screening, or they would roll down their windows so they would be cold, you know, in the winter so that they could get through the temperature screening. But there was just this constant pressure to work. They also talked about, you know, some problematic power relations. And a lot of that has to do with that supervisor employee relationship, because there is so much power concentrated in that supervisor. So things that may be happening at a corporate level or at a management level don't always trickle down to the individual line worker level. And so as Julia was mentioned, there's a lot of top-down approaches. Just that's sort of been our, you know, as a society, kind of the way that we approach things. It's top-down and we'll let it trickle down, but we need to have both top-down and bottom-up approaches so that we can meet in the middle. The workers also talked about how this has just made safety even worse in the facilities. I mean, you know, from the infection prevention and control side, masks are good, right? But imagine working on a line for 8, 10, 12 hours a day with a mask on in a cold environment with all of this gear on, and you have your safety goggles on. And what happens when you wear a mask and you have safety goggles? Your goggles fog up. You can't see. So do we want people with big long knives cutting things when they can't see? I mean, they talked about some of these experiences that they had, and they worried about cutting themselves or getting hurt because of the safety goggles and the masking requirements. So in fact, they thought it was a better idea to pull the mask down, keep the safety goggles on so that you can see and get your work done. They also talked about how some of the responses in the workplace had been delayed or contested, like the mask issue. Like that sort of a debate among workers is a good as a bad. And that this has led to, you know, more limiting of the healthcare services that are available to them. They also talked about the impact that this has had on their lives outside of work. I interviewed numerous workers who talked about, you know, how they themselves had been affected by COVID. One of the ladies I had talked to, she had been in a coma. She had been on a ventilator. She had been in the hospital for, you know, more than a month. Her family thought she was going to die, and that impact that has on the family. I talked to another woman whose husband died from COVID and how that has affected the family of 5 children. You know, these are things that have real implications, you know, these decisions to, you know, that people have to make. Is it a livelihood for my family, or am I going to worry about my health and safety? You know, like, so they're always, you know, trying to balance, you know, what is it that I can do to keep safe, but also be able to make some money to keep my family, sustain my family. The workers also talked about, you know, that if we want to really improve the situation in these facilities, that maybe it's time that we listen to workers. Workers probably have a lot of good ideas, and they would share with us a lot of good ideas, but they said, hey, why don't you all listen to us? If we tell you we're sick, let us stay home, let us recover, and we'll come back to work. Hey, why don't you ask us about how we should improve safety on the line? We're the ones working on the line every day. We might have a good idea. So they really focused in on this idea that we need to listen to workers. We need to learn from their experiences, and we've got to figure out ways to humanize production. Like a cow cannot be more valuable than a human life on these lines. It's just not acceptable in their view. So being essential has really changed the dynamic. I think for some people, it has empowered them to speak up. And for others, I think it has had the opposite effect, like they feel more powerless. So it really depends on who you're talking to and how they describe their experience. But definitely this you know, being called or being labeled essential has had an impact on workers' lives.
That's fascinating. So before I go to the next question, I just want to talk to the audience. If you do have questions, please put them in the Q&A. You know, we're rapidly approaching the last half hour, and I want to make sure everybody's questions get answered. And for those of you who have already asked questions, I'm going to get those in here in just a few minutes. So our next question really gets to the crux of the matter. And this is for Abby. And what are the central ethics concerns when considering things like COVID and protein processing workers?
Yeah, so early in the pandemic, I think we talked a lot about solidarity, kind of we're all in this together. And I think solidarity also acknowledges this interdependence within a community, and it underpins how we take care of one another and how we are all vulnerable to something like an emerging infectious disease like COVID. And we think about how do we support our interdependence and maintain important social infrastructures based on common interests and mutual advantage. But I think the thing that solidarity doesn't account for kind of lies in this idea of essential work. We're not all equally vulnerable in these moments in time. I get to work from home, and someone else has to go to a meat processing facility. And at that moment, there becomes a disproportionate burden on some people to face risk than others. So, I think if we're thinking about it that way, we have to think of a gradient of vulnerability to risk as well. And that certain things are owed to people who we're going to call essential based on what we're asking of them. And that we're saying, we want to have food as a country. So you're going to have to keep going to work, and we're going to go sit home and figure out, once the scientists tell us how to be safe in the world, you all continue on, please, and so something is owed then to people who we call essential. And I think, something that became problematic, I think, is that essential workers or frontline workers usually were how we referred to healthcare workers. And there's a great body of literature and evidence on how healthcare workers stay safe in emerging infectious diseases. And so, you glom this whole group of people together and call them essential, but certain people have better access to what will keep them safe in emerging infectious disease than others. And so I think that bore out over COVID-19. IPC guidance tended to emphasize the importance of adequate protections for some workers, and it neglected other personnel and other workers in key roles that we were saying, hey, we as a nation, we want to eat. And you can argue whether or not we need to eat meat, right? But I think that, we said that you're essential, but we didn't follow up. We didn't give the reciprocal value to those workers to ensure protections. And I think even despite their key role, meat processing workers' key role in keeping this country going, we neglected guidance and protections, and they suffered disproportionate risk and disproportionate disease burden due to that. So,
definitely a lot to think about there. So Julia, thinking about this concept of an essential worker, and also thinking about the composition of this workforce, I think there's a need for external support systems outside of the plant to help ensure health and safety. I mean, what could you tell us about external supports?
Absolutely. I mean, I think that over and over again, what we heard from folks about, just doing kind of vaccine outreach, for example, is that there are so many other urgent priorities that folks are dealing with to stay alive, to keep their families safe, to keep food on, to stay in their house, to keep the water on, to keep the lights on, to keep, immigration officials from knocking at their door. There's so many things that they're dealing with that even if in some cases, vaccination's right there and they want it, they don't have an issue that it's the 5 minutes that it would take to do that is trumped by, the investment of those 5 minutes elsewhere. I think in general, when we talk about support systems, just stronger social safety net in general, that's really addresses the multiple intersectional needs that folks have. We have a lot of exclusions for migrant workers, or a lot of communicated exclusions. And in general, we just don't really have a social safety net in this country. It's gotten a lot worse. When we've had an opportunity to improve it substantially because of this experience. So I think, kind of addressing some of those basic needs. One of the solutions that some of our partners have put together throughout this pandemic, and we talk about mutual aid, put together kind of these one-stop shops where they'll move a fair around every weekend to different rural areas. So they'll bring dozens of organizations and the food bank and health clinics and legal services and immigration support to these places. They'll bring, started working in things like vaccination opportunities to those as well. And they're one-stop shops where people can go and kind of take care of everything at once. And so that's been really helpful, but, we could, obviously operate much more efficiently at a larger level with state funding, et cetera, for those kinds of models. But really understanding that there's a lot of intersectional needs and flexibly supporting and funding opportunities to address those. There's a lot of really, there's a lot of trends toward issue specific funding. I'm talking about private funding, I'm talking about state funding too. Or, really very with, okay, we're going to fund training, but it's on this one kind of training, but we need to get broader and more intersectional with our relationships and the way that we can think about kind of public health and the intersection of public health and occupational health.
Appreciate that. I think there's a lot of things to think about globally, not just at the workplace. So I think that really talks to that. So thinking about some of the solutions, and more specifically to COVID in these workplaces. So Abby, what do you think are the practical solutions to protect the health and safety for the next pandemic, or the continuing pandemic, I should say?
Yeah, that's a great question. And I think, one area is to increase, which, Athena can speak to some of the work that she's doing here, but is to do research on health and safety for protein processing facilities, to understand mask research, IPC research, and modeling as well, to kind of understand disease spread and be able to kind of get ahead of things, I think is a clear need. And for organizations like NIOSH to really intersect in these ways, in powerful ways, if you're going to call certain domains essential, that you also have research and protections to support those industries. And then the other one that I don't think I've talked as much about, but that we've heard a lot about on a qualitative research project that Athena and I are working on, is the importance of community health workers and the importance of really building that workforce and making sure they have adequate funding and support and are integrated with local public health in meaningful ways to support the communities that are impacted by disease outbreak.
So Julia, what promising opportunities are there that are out there to really strengthen working conditions in the protein processing industries?
Love this question, because I think, sometimes we talk about activism and all we do is complain about stuff, but there's opportunities out there. I think keeping our eyes open that none of this, a lot of these issues are because of choices we've made on how to structure our societies and what rights and benefits to give to different kinds of people, and that they're not inevitable. So I think my co-panelists have mentioned, solidarity, organizing. We've seen kind of this tension between, essential workers being lifted up and only to realize really how truly disposable they are and the lengths to which we'll go to, leave them behind essentially. Actively, industries lobbying at these great levels, to stay open and limit protections. But that's also inspired some really incredible stories of organizing, both formal union organizing, and I think we've seen just kind of solidarity being built in less formal ways as well. So there are some great opportunities there. I think we also, talk about the harms that social media have created and produced in disseminating misinformation. But I think we also still believes that, democratization of information with maybe the right kind of controls and monitoring is really wonderful, especially for communities that don't trust in some of these kind of traditional messengers or state structures, or who just don't have access to them or have been excluded from access to them. And that's something that we've kind of invested in a lot at CDM is, worker voice technologies designed with workers, finding ways to create messaging and opportunities that are cheap or even free, translation technologies built into those. So that's kind of been a silver lining a little bit of the pandemic too, is just how it's pushed in communities that have been kind of traditionally left behind by, communications infrastructure advancements, pushed folks kind of into greater familiarity with or adoption of those kinds of technologies, like as it has for many of us. I don't think we've had a lot more experience with Zoom than we've ever had before. So that's kind of happening on a different level. And I think that's something that we want to pay attention to and see how we can take advantage of that for these progressive goals that we may have.
So going off of our script just a little bit, we have some questions around, really focused around communication. And I think this is a good place to talk about that, and really thinking about what were the lessons learned in terms of things like language and literacy barriers and how they impacted the creation of, the policies and the education materials around PPE and symptom screening and all those sorts of things. Does anybody want to take that on?
I can talk a little bit about some of our work and what we heard. So it came through in many of the comments from workers about how they wanted somebody to talk to them. They didn't want to get a piece of printed material. They didn't want, a thing on the screen at their workplace, a message on the screen. They just wanted somebody to talk to. And sometimes that, like Abby brought up, that idea of a community health worker or a lay health advisor, or whatever term you want to put it, promotora, or a person like that who has the skill set to be able to communicate with people in a way that they can understand, is a really good and effective way to get information across. We, of course, as everybody did, we tried to create some materials. We developed some printed materials in lots of different languages. We had them in English and Spanish and French and Vietnamese and Arabic. And we tried to keep it simple, keep the point simple and actionable, knowing that, literacy may be an issue. And as you translate, becomes even more of an issue, is to keep the information very, very succinct and very, very simple. But we also found from one of our community partners, which is a Mayan community organization, and within their community, they speak a Mayan language called Kanhawal, which is a spoken language, not so much a written language. It is written, but the people here don't really read the written language. And so we were talking to them, because a lot of these folks are employed in the meatpacking facilities here. How do we get this information across? And they said, well, everybody listens to marimba music. And they said, people bring up a video on YouTube and they listen to marimba music. So why not speak the information over the marimba music, which is exactly what they did. So they took what we had written, the simple bullet points of what to do to protect yourself at work and what to do to protect yourself at home, and they spoke it over marimba music. So that's just one example of this cultural and linguistic translation of information that we had within our experience.
Does anybody else want to add on to the communication best practices?
I might, go ahead.
No, you go ahead, Julia.
Maybe just a tiny little kind of anecdote, I think, from our project where we developed a communications campaign and have spent a lot of time thinking about this, and I've spent a lot of time focusing on audiovisual materials for the same reason. And it's maybe, I think we have to also understand there's one thing is what folks can do, and another is what they prefer to do. I can read, I prefer to listen to podcasts, right? Like every, project process workers also have preferences. And so we want to be communicating to those rather than, again, sort of what we've measured necessarily in terms of like literacy levels, but they're of course connected. And I think we've spent a lot of time talking about sort of transgression and that thinking about the cultural context that folks come from, that, you know, not all Spanish-speaking communities are the same and respond to the same vocabulary or the same messengers or sentence structure. So keeping things local, and always, I think one of my co-panelists mentioned centering workers, the community in that process as much as possible. We've tried to do that through some work committees that we have. We have an advisory committee that are protein processing workers who are paid as consultants for their time, limited amount of time, but what little time they have, we wanted to make sure that they could prioritize the consulting that they're doing with us. And so they'll, you know, tell us things like these colors are terrible, you know, or one community member saying these colors are great and these other colors, these colors are terrible. So coming to consensus is a bit, of course, challenging, but you know, thinking about what communication means is a whole host of sights and sounds and other things that can be make a huge difference to folks.
So another question that we have is really focused on how much you have used community partnership building in really connecting those you serve with services related to these trusted messengers. Does anybody want to take that on?
Well, partnerships, I think, have been integral to everything that we do. In my role at the university, I work in the Center for Reducing Health Disparities, and my group and I are kind of like liaisons between our campus community and the external community. And so my team and I, we focus on Hispanic and Latino communities. And the idea is to be liaisons. So we're constantly in communication. It isn't just a pandemic thing. Like, this is the work that we do all the time. This idea of being really engaged and integrated into community infrastructure is something that we really take to heart. And so I've had, you know, long-standing partnerships in the community that are 20 plus years. And I continue to build new partnerships as we expand, you know, the scope of the work that we're doing. But I think partnerships are vital, and you shouldn't wait for an emergency to have a partnership. Like, we should be working on partnerships at all times and maintaining and building new partnerships, maintaining the old partnerships and building new partnerships consistently.
I think that's what a lot of people learned. They had lots of partnerships, but not necessarily the right partnerships when it came to this pandemic. So really thinking through the purpose of those partnerships and how you can help each other is really important in really a situational kind of environment. So it's another question from an attendee, and we talked about things like attendance incentives and production incentives. And so the question is, what are the next steps for continuing to maintain visibility and accountability around these types of practices? And really, these are predatory practices towards these workforces. And so what's the next steps? How do we keep that in the forefront? What do we do next? Anybody want to take that?
Well, I think that's a hard question.
It's a really hard question.
I think it's a hard question. I know I could see Abby wanting to speak, but not quite sure, and Julia too. I mean, it's a hard question of how do you maintain the visibility? I think it's a unique time point where there is some visibility, but these things have been going on long before this pandemic came along. And, you know, there's kind of like this ebb and flow of attention on it. And, you know, I don't know that I have any answer on how to maintain that, other than I think it's important and we should think more about how to do that. I don't know if my co-panelists have other ideas.
You know, I've thought about it. I'm like you, Athena. I don't know that I have anything that's like, oh, that's the ticket. But I think through the pandemic, there became greater awareness and greater concern for health equity. And through that became more visible in our funding streams at universities, the importance of health equity. And so I think from where I sit in my lane, it's thinking about how do I advocate for this work with this population in these funding streams so it continues to carry forward, and it doesn't become something that we just forget about and move on. But it's difficult because I know we all experience that there are moments in time where things become, there's greater awareness, greater acceptance on a need to do something about it. And then it can fall back, and it's important to, be on the ground and continue to do the work that will support workers in the future. So again, not sure if that's the ticket to anywhere, but I think that, in terms of a solution, that's the best I got right now. So
I think it is continuing to talk about it for sure. I really like the term predatory employment practices. And I mean, from my perspective as an educator, really making sure that these types of things are taught in our classes around occupational health and safety, making sure that we really teach the next generation about these practices and how to identify them for sure. So another question from the audience. Do you all see that there have been any permanent positive changes in the industry for either worker rights, quality of living, or safety?
I mean, one thing that has changed is wages. When before the pandemic, I think an average wage may have been around $14, $15 an hour. And now in the processing plants that I've been around, the starting wage is around $25 or $26 an hour. So there has been a significant increase in wage. The question, is that a living wage? Well, maybe not. Especially, is it a just wage for the type of work that you do? Well, maybe not. But it is an increase in wages from where we started a couple of years ago. So that, I would say, is at least one positive change.
I would say, and kind of want to respond to that too. I think within the seafood processing and those industries that rely on H2, we just function a little differently. The market kind of dynamics are different and decently artificially constrained kind of within those programs. But we've seen, I think, more and strengthen relationships between public health infrastructure and community-based organizations. Like our project is one of many. I think there's sort of kind of a reckoning with the federal government that we needed to get closer to disproportionately impacted communities, and did so by reaching out to organizations. So we know each other a lot more. We understand and kind of get each other in a more, diverse organizations working together as well across geographies, across specialties, disciplines, with, academic institutions to be able to publish some of this, get some literature out there on best practices. So hopefully those will also kind of have an impact longer term as well. But sort of, those relationships are I hope, we're being optimistic that we can continue them and take them forward, that we're not just going to kind of turn our brains off and go back to, before the pandemic, but that we'll use those to work on these other issues that have been pushed under the rug because of the pandemic or exacerbated because of the pandemic, where there is an opportunity to continue to work on them. So continuing to hold on to that optimism.
Thank you. So here's our opportunity. This is looking at the future. We are all really good at predicting the future, as we've all discovered in the last 3 years. So if we have a new pandemic or a new variant, do you all think it would happen differently the next time around? and what would happen differently the next time around? The only thing I would say is I hope we have a whole lot more N95 masks in stock the next time around than we had this time. So if we've learned anything, hopefully we've learned how to produce N95 masks in our country in great numbers. But anybody else want to comment?
Well, I think we've also learned about the context and how context is very important in terms of transmission. And so trying to apply what we know from healthcare to an industrial food facility is quite different. And so I think we've learned the importance of context. So moving forward, I would anticipate that we would maintain that focus on the context and being able to provide more contextually relevant ideas and recommendations if this were to happen again.
You know, I don't know about a variant if things would be markedly different now. I do think that we do need to do something about disproportionate burdens that are put on some people in society based on, you know, voids in structural protections for those workers. I think it creates a space where we're obligated, both employers, regulators, community members, to find solutions to keep workers safe as possible. And, you know, in a pandemic, that only benefits everybody. The health of the worker is the health of the family member, is the health of the community member as well. So I think that this really is a call then to kind of reposition these workers so that we account for those structural voids and that we support them and treat the risk that we're asking of them equitably. So, and I think, you know, that means, for me at least, that pandemic planning and emerging infectious disease planning needs to explicitly call out essential workers in all industries, not just in healthcare, and be explicit also about what protections are needed to be developed and to be maintained. And stakeholders from those communities, workers in those communities, like Athena was talking about earlier, listening to them about the solutions and having them at the table as we plan in kind of preparedness for a next emerging infectious disease outbreak, which, you know, I think 6 months ago felt like, well, that won't happen again. But of course, you know, now we're talking about monkeypox as well. So I think that, you know, thinking about how we do this and having those key stakeholders at the table as we think about preparedness and planning and research moving forward.
I would just, go ahead. I would just add a real definition for an essential worker and an ethics-based definition for essential worker, which we still don't have, but we'll get there. Julia?
Yeah,
Do you want to add something?
I agree with that too. Kind of untying maybe this idea of essential and skilled, right? What we've determined to be unskilled and therefore compensate lower is often not all unskilled. Very, very challenging in many levels and should be compensated adequately. But with the, in terms of, yeah, what would we do better? I think next time, I think we're potentially in a position to do better. We have a lot more knowledge. We have a lot more greater relationships, some practices, some habits we've developed. I know a lot more science, for example, I think I do, I don't know. And, you know, we're kind of in a potentially better position, but operationalizing it, you know, are we going to be able to maintain those structures? Are we able to fund them? There's been so much kind of free work that nonprofits have done, individuals have done to keep folks alive. These mutual aid networks that have popped up are all just redistribution of resources done kind of independently and informally. And if we're able to and right now there's a lot of organizations that have been doing the work to try and keep people safe, to get folks vaccinated, thousands and thousands of vaccines, that are now laying people off because the funds are drying up to do that. And so, our organization is going to be in a position to jump in and act quickly. It kind of depends what we do right now to be able to support those and to prioritize those responses and maybe use them for other things that we considered not, emergent pandemic emergencies, but that are very real emergencies that people are living through on a day-to-day basis and have been living through, that we've sort of normalized.
All right, we are down to our last questions. So I'm going to give, you each are going to get one, and you're going to have a minute and a half. So that makes sure everybody gets one. So Athena, what has been the most surprising finding in your time examining the lives, concerns, and hopes of the people working in this industry?
I think one of the most surprising things is that that a lot of the circumstances haven't changed in so long, and that's a little bit depressing and a little bit sad. And so I think we need to figure out new structures, new infrastructure, and new ways of working together to be able to really improve the lives of these workers.
I like that. So Abby, so we've danced around it a lot, but what would you say when we call workers essential and say they must continue to work? What do we owe them?
Well, I think we owe them on-site protections, which we've talked quite a lot about at the facility. We owe them safety at their workplace. And I think we are in a better position to know what that means in terms of COVID-19. I think we owe them off-site protections, which is, access to testing, access to healthcare, access to social supports that they may need based on going into risk every day. And then they're also owed careful thought and allocation of treatments, vaccines, things that we call medical countermeasures in my world, and that those should be allocated to them as well. So, and all that takes a lot of time and thought work, and again, having them at the table in planning, so that planning and response accounts for protein processing workers as well. So
thank you, Abby. So Julia, you get the last one. And the last one is, why do we need to stop saying we need immigrants to do the jobs Americans don't want to do?
And I hear this a lot from folks who are very well-intentioned, who identify as pro-immigrant, as, of course, we need immigration reform, or, we need more immigrants, or to value immigrants because they'll do the jobs Americans don't want to do. And at the end of the day, even though it sounds complimentary, or maybe at the end of the day, it really justifies immigrants as an exploitable class of people. It justifies relegating them to a secondary citizenship, and to some extent glorifies the exploitation too. We see that being passed on as, certain types of immigrants are hardworking, and that's given as a compliment, but it's a type of kind of positive discrimination that kind of solidifies and reproduces the social hierarchies based on racism, based on kind of myths that persists in society. And it also fails to account for the context, which make it economically worthwhile for someone who's maybe earning in dollars and spending in pesos or another currency to take on higher levels of risk, or to earn quote unquote less wages, and sort of for the artificial market constraints that are put on people when we exclude them from safer jobs, from higher wages, from social safety net. So yes, I would encourage folks to think differently about how we approach our position on immigration for that reason.
Okay, well, that ends our panel today. I thank all of our panelists for their very thoughtful responses. And I think Madison has one more thing to say before we leave. So thank you all. I appreciate your thoughtful responses.
Yes, thank you, everyone. This was, I think, an absolutely wonderful discussion. And thank you again, Mike, for moderating. You did a wonderful job. Just a few follow-up notes. Today, when you close out of this webinar, you will be redirected to the survey that I mentioned at the beginning of the webinar. This is where you will be able to give us some feedback on this series and claim those continuing education credits that you may be looking for. We also invite you to join us for our next webinar in this series that is on September 7th, and this is going to focus on ethics and intentional hybrid work. When you close out of the survey at the end of the webinar, you will also be taken to the registration page for this one if you're interested. So thank you again, everyone, and keep an eye on your inbox for any follow-up resources and the recording for this webinar.